Today we will discuss Addison's disease, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Addison's disease is a condition where the adrenal glands, which are located on top of your kidneys, don't produce enough hormones, especially cortisol. This hormone helps your body respond to stress, maintain blood pressure, and manage metabolism. Simple symptoms to look for: fatigue, feeling unusually tired or weak, weight loss, unexplained loss of weight and appetite, low blood pressure, dizziness or fainting when standing up, darkening of the skin, particularly in areas like scars, skin folds or mucous membranes, salt cravings, a strong desire for salty foods, nausea or vomiting, digestive issues that seem unusual. How to know if you have it. If you suspect you have Addison's disease, it's important to visit a doctor. They may perform the following: blood test to check hormone levels and electrolyte balance, ACTH stimulation test to see how well your adrenal glands respond, imaging test, sometimes to view the adrenal glands directly. Early diagnosis and treatment are key to managing the condition effectively. If someone has Addison's disease, here's what to do in simple steps. See a doctor, follow up with a healthcare provider for proper diagnosis and treatment plan. Take meds. Usually people need to take hormone replacement medications daily to manage the condition. Monitor symptoms. Keep track of any changes in symptoms and report them to the doctor. Stay hydrated. Drink plenty of fluids, especially feeling weak or dizzy. Eat a balanced diet, including enough salt unless advised otherwise by a doctor. Manage stress. Find ways to reduce stress as it can trigger symptoms. Wear a medical ID. Consider wearing a bracelet or necklace that indicates the condition in case of emergencies. Know the signs of crisis. Be aware of severe symptoms like extreme fatigue or confusion, and seek emergency help if they occur. Following these steps can help manage the condition effectively. In the hospital, if someone is having a crisis due to Addison's disease, they typically do the following: administer IV fluids to help with hydration and balancing electrolytes, hormone replacement, like cortisol, and they do that through an IV to quickly restore those levels that have dipped down below the normal levels. Monitor vital signs. Keep a close watch on heart rate, blood pressure, and other important signs. Remember that since cortisol is a stress hormone, and this is what we're lacking now with this condition, that's why we're monitoring for a low heart rate or a low blood pressure. Blood test. Check blood levels to assess hormone levels and overall health. Treat symptoms. Address any other symptoms like nausea or confusion to stabilize the patient. And because cortisol affects metabolism, that's why we're also looking out for GI symptoms. Supportive care. Provide comfort and support, ensuring the patient feels safe and cared for. The quick response helps to stabilize the patient and manage the crisis effectively. Here are some commonly used medications for Addison's disease. Hydrocortisone. This is the most common medication used to replace cortisol. Prednisone, another corticosteroid that may be used if hydrocortisone isn't suitable. Fludrocortisone. This medication helps replace aldosterone, which helps regulate salt and fluid balance. These meds help manage hormone levels and alleviate symptoms associated with Addison's disease. Always consult a doctor for personalized treatment. People at an increased risk of developing Addison's disease include autoimmune conditions. Those with autoimmune disorders such as type 1, diabetes, or thyroid disease may be more likely to develop Addison's. Family history: if someone in your family has Addison's disease or other autoimmune diseases, your risk might be higher. Age and gender. It can occur at any age, but adults between 30 and 50 years of age are more commonly affected and is highly more common in women. Infections. Certain infections, such as tuberculosis, can damage the adrenal glands and increase risk. Adrenal gland issues. People who have had damage to their adrenal glands from injury or surgery might also be at a higher risk. Being aware of these factors can help in monitoring health. Now you need to watch my video on fibromyalgia.